Medical Dispatch is a digital broadcasting program designed to give you general medical information and is not medical advice. Please consult your personal medical team for any medical advice. Medical Dispatch is for informational use only. Medical Dispatch can be heard only on the USA EBN Digital Broadcasting Network. www.usaebn.org. Welcome to Medical Dispatch. Hi everyone, and welcome to Medical Dispatch, your clear, calm guide to medical news and what it means for your family. I'm Heather Owens, your host. I'm a registered ER nurse based in Cleveland, Ohio, and I've spent the last decade working in one of the busiest emergency departments in the Midwest. I've seen firsthand how confusing, overwhelming, and sometimes downright scary medical news can be, especially when it hits close to home. That's why this show exists. Medical Dispatch is here to help you make sense of the headlines, understand what's real, what's hype, and what you can actually do to protect your family's health. We're not here to give medical advice. That's what your personal medical team is for. But we are here to help you ask better questions, feel more confident in your decisions, and stay informed without the stress. So whether you're a parent juggling school forms and flu season, a caregiver supporting an aging loved one, or just someone trying to keep up with the latest health alerts, we've got you. Let's get into today's dispatch. What this show is and isn't. Before we dive into the news, let's talk about what Medical Dispatch is really about. This show is built on 3 promises. Plain language translation of complex medical topics. No jargon. No hype. Actionable checklists you can use right away, at home, at school, or on the road. Trusted sources and transparency. We'll always tell you what we know, what we don't, and where you can learn more. And here's what we're not. We're not a substitute for your doctor, nurse practitioner, or care team. We don't diagnose. We don't prescribe. We don't tell you what treatment is right for you. Instead, we help you understand the landscape, so you can walk into your next appointment prepared, informed, and empowered. Meet your host. Let me tell you a little more about myself. I'm Heather Owens, a third-generation Asian American woman born and raised in Cleveland. I grew up in a multicultural household that taught me the value of education, public service, and community resilience. I've worked in emergency medicine for over 10 years. That means I've seen everything from broken bones to heart attacks to mental health crises. I've held hands during the worst moments of people's lives and celebrated with them during the best. I'm also deeply involved in health outreach programs, especially those serving immigrant communities and underserved neighborhoods. I believe that everyone deserves access to clear, respectful, and culturally aware health information. That's why I'm here. That's why this show exists. Why Medical Dispatch matters. Let's be honest, medical news today is overwhelming. One minute you're reading about a new vaccine. The next, there's a recall on baby formula. Then there's a heat advisory, a flu surge, and a warning about air quality, all in the same week. It's a lot. And for families, it's not just information, it's decisions. Do I send my kid to school today? Should I cancel that trip? Is this cough serious? Medical Dispatch is here to cut through the noise. We give you calm, curated clarity. We don't chase clicks. We chase truth. We know that preparedness and prevention matter more than ever. So we're here to help you build your home pharmacy, prep for seasonal risks, and understand when to go to urgent care versus the ER. What you'll hear each show. Every episode of Medical Dispatch follows a simple format. News you can use. We break down current medical headlines, advisories, recalls, and outbreak updates. Family safety and preparedness. Practical guides for first aid kits, travel health, school forms, and more. Expert insights and myth-busting. Interviews with clinicians and public health experts. Health system navigation. Tips on choosing care settings, preparing for appointments, and getting second opinions. Community spotlights. Resources like poison control, mental health hotlines, and emergency prep guides. And every episode ends with a family action checklist. Simple steps you can take today to protect your loved ones. News you can use, breaking down the headlines. Let's talk about what's in the news and what it actually means for your family. This week, the CDC issued an advisory about a spike in RSV cases across several states. If you've got little ones at home, this matters. RSV, respiratory syncytial virus, is common, but it can be serious for infants and older adults. So what do you need to know? RSV spreads like the flu, through droplets and surfaces. Symptoms can look like a cold at first, but watch for wheezing, rapid breathing, or dehydration. If your child is under 6 months or has a chronic condition, talk to your pediatrician about preventive options. And here's your family action checklist. Wash hands frequently. Keep sick kids home from daycare or school. Disinfect high-touch surfaces daily. Know when to call your doctor, especially if breathing looks labored. We'll link to the CDC's RSV tracker in the show notes. Family safety and preparedness, your home pharmacy. Let's shift gears and talk about something practical, your home pharmacy. If you've ever had a sick kid at 2 a.m. or needed a bandage after a fall, you know how important it is to have the right supplies on hand. Here's what every family should stock. Fever reducers, acetaminophen, ibuprofen thermometer. Rehydration salts or electrolyte drinks. Bandages, gauze, and antiseptic. Allergy meds, antihistamines, a list of emergency contacts and medications. And don't forget, check expiration dates every season. Store meds in a cool, dry place away from kids. Keep a travel version in your car or diaper bag. Preparedness isn't panic, it's peace of mind. Expert insights, when to go to the ER. Let's talk about something I get asked all the time. When should I go to the ER? As an emergency nurse, I want you to know that not every health scare needs an ambulance. But some do. Here's a quick guide. Go to the ER if you have chest pain, trouble breathing, severe bleeding, or signs of stroke. Urgent care is great for sprains, minor cuts, ear infections, and mild fevers. Telehealth can help with medication refills, rashes, and follow-up questions. And here's the golden rule. If you're unsure, call your doctor or nurse line. They'll guide you. We'll include a printable decision chart in the show notes. Myth-busting, flu shot edition. Why myth-busting matters. In today's world, medical news and health advice travel faster than ever. Social media, podcasts, and 24/7 news cycles mean that families are bombarded with headlines, opinions, and expert takes, some helpful, some harmful, and some downright dangerous. As your host, I've seen firsthand how misinformation can sow confusion, fear, and mistrust. That's why Medical Dispatch is committed to myth-busting, cutting through the noise, clarifying what's real, and empowering you to make informed decisions for your family. Understanding the landscape. What is disinformation? Let's start by defining our terms. Misinformation is false or misleading information shared without harmful intent. Disinformation is deliberately false information, spread to deceive or manipulate. Malinformation is accurate information twisted out of context to cause harm. These aren't just academic distinctions, they shape how we respond. Misinformation often spreads because people want to help or connect. Disinformation, on the other hand, is weaponized. It's designed to provoke, polarize, or profit. Why are myths so sticky? Medical myths persist for several reasons. Emotional impact. Content that triggers fear, hope, or outrage is more likely to be shared. Social connection. People share information to bond with others, even if it's not accurate. Speed over accuracy. In the rush to keep up, fact-checking falls by the wayside. Echo chambers. Algorithms feed us what we already believe, reinforcing biases. During the COVID-19 pandemic, for example, myths about vaccines, treatments, and the virus's origins spread rapidly. Some were rooted in genuine confusion. Others were pushed by bad actors with political or financial motives. Recognizing the tenacity of these myths is the first step toward combating them. But the real challenge lies in addressing their consequences head-on. Whether it's confusion about vaccines, uncertainty about treatments, or wavering trust in health authorities, the spread of false information has real-world effects that put families at risk. By equipping ourselves with reliable tools to evaluate sources and by fostering open, fact-based conversations, we can push back against the tide of misinformation and empower each other to make decisions grounded in science and compassion. The real-world impact. Why busting myths saves lives. Misinformation isn't just annoying, it's dangerous. Vaccine hesitancy. False claims about vaccine safety have led to outbreaks of preventable diseases. Treatment delays. Myths about miracle cures or natural remedies can delay proper care. Distrust. Repeated exposure to conflicting information erodes trust in healthcare providers and public health systems. As an ER nurse, I've seen patients arrive in crisis because they followed advice from unreliable sources. I've also seen families struggle to make decisions amid a flood of contradictory headlines. That's why developing critical thinking skills and sharpening our ability to spot misinformation are so essential, not just for healthcare professionals, but for everyone. By learning to question sources, demand evidence, and recognize manipulative tactics, we strengthen our defenses against harmful myths and empower ourselves to make informed, life-saving choices. Armed with practical strategies for evaluating information, we can help protect our communities, support our loved ones, and restore confidence in science and medicine. How to spot disinformation, a practical guide. Here's your myth-busting toolkit. 1. Check the source. Is the information coming from a reputable organization, CDC, Mayo Clinic? Or is it a random social media post or anonymous blog? 2. Look for evidence. Does the claim cite scientific studies, expert consensus, or official guidelines? Or is it based on anecdotes, testimonials, or secret knowledge? 3. Beware of absolutes. Science rarely deals in black and white. Be skeptical of claims that promise miracle cures or guarantee disaster. 4. Follow the money. Is someone profiting from your fear? Sales pitches often follow sensational stories, whether it's for a supplement, device, or political agenda. 5. Ask who benefits. Why is this person or group sharing this information? What do they gain? 6. Cross-check. Verify with multiple trusted sources. If only one place is reporting it, be cautious. Building on these practical tips, it's important to foster an environment at home where questions are welcomed and skepticism is encouraged. Not as cynicism, but as a healthy habit for navigating today's crowded information landscape. Encourage family members to share new information they encounter and work together to analyze it using these critical thinking strategies. By practicing regular information check-ins, staying up to date with guidance from trusted medical professionals, and supporting one another in staying calm amid uncertainty, families can become resilient against the constant barrage of misinformation. This collaborative approach not only strengthens individual confidence in making health decisions, but also helps to cultivate a community-wide culture of trust, vigilance, and science-based understanding. Navigating the infodemic, best practices for families. 1. Build media literacy. Teach your family to question sources, spot clickbait, and recognize emotional manipulation. 2. Use actionable checklists. Keep a list of trusted resources, CDC, local health department, poison control, and know when to call for help. 3. Stay calm and curious. Don't panic. If something sounds alarming, pause and investigate before acting. 4. Engage with your care team. Bring questions to your doctor, nurse, or pharmacist. They can help you sort fact from fiction. 5. Community outreach. Participate in local health programs, town halls, and educational events. Nurses and clinicians often lead myth-busting sessions and provide evidence-based guidance. In addition to these best practices, it's valuable to leverage new forms of media for ongoing education and myth-busting. Medical podcasts and trustworthy online platforms can offer accessible, reliable updates by translating complex topics into clear, actionable advice. By integrating these resources into your family's routine, you can enhance your collective understanding and readiness to respond thoughtfully to emerging health information. Whether by tuning in to expert-led discussions or participating in local workshops, families not only protect themselves, but also contribute to a broader community effort to promote evidence-based decision-making and public health. Ultimately, fostering an atmosphere of open dialogue and critical inquiry equips everyone to navigate the infodemic with confidence and resilience, setting the stage for responsible, informed choices in the face of uncertain headlines and evolving medical news. The role of podcasts and media, responsible myth-busting. Medical podcasts like Medical Dispatch, Maintenance Phase, and Body Stuff with Dr. Jen Gunter are dedicated to breaking down complex topics, debunking myths, and providing context. They use plain language, cite sources, and invite expert guests to clarify controversies. As a host, my promise is to translate medical jargon into everyday language, share actionable steps for family safety, always tell you what we know, what we don't, and where to learn more. By embracing these trustworthy media sources and incorporating their insights into your daily routine, you empower your family to make better decisions and reduce confusion when confronted with uncertain news. The guidance offered by medical podcasts complements the practical strategies outlined above, reinforcing your ability to pause, verify, and seek expert advice before acting on alarming headlines. Ultimately, these combined approaches foster a resilient, informed household that can confidently distinguish fact from fiction and respond appropriately to evolving health information. When to worry and when to wait. Not every alarming headline requires immediate action. Here's a quick guide. Go to the ER. Chest pain, trouble breathing, severe bleeding, signs of stroke. Urgent care. Sprains, minor cuts, ear infections, mild fevers. Telehealth. Medication refills, rashes, follow-up questions. Call your doctor. If you're unsure, reach out for guidance. Knowing when to act and when to wait can help you avoid unnecessary stress and ensure your family receives the right care at the right time. After assessing the urgency of a situation, focus on building trust through open communication and informed decision-making. Transparency, empathy, and a commitment to reliable information create a strong foundation for myth-busting and empower you to support your family's health with confidence. By verifying sources, keeping a list of trusted medical sites, asking questions, and sharing knowledge, you contribute to a culture of clarity and resilience, helping your household navigate uncertainty with assurance and compassion. Building trust, the heart of myth-busting. Trust is built through transparency, empathy, and consistency. As a nurse, I strive to meet patients where they are, listen to concerns, and provide clear, respectful information. Myth-busting isn't about shaming or arguing. It's about empowering you to make informed choices. By fostering trust in your household, you create an environment where family members feel comfortable discussing uncertainties and seeking clarification instead of acting on fear or misinformation. Encouraging open dialogue, validating each other's perspectives, and consistently turning to reliable resources not only strengthens your collective understanding, but also equips everyone with the confidence to handle health-related challenges thoughtfully. This commitment to honest communication and shared learning lays the groundwork for lasting resilience in the face of evolving medical news. Empowering your family to make sound decisions, support one another, and become advocates for truth both at home and within the wider community. Your family action checklist. Verify before sharing. Pause and check sources. Bookmark trusted sites. CDC, Mayo Clinic, local health department. Ask questions. Bring concerns to your healthcare team. Educate others. Share what you learn with friends and family. Stay updated. Science evolves, keep learning. By putting these steps into practice each day, you'll create a foundation for health literacy that benefits your entire household. As you build habits around careful sharing and ongoing education, your family becomes more equipped to respond to new medical updates with confidence and calm. Developing these routines not only helps you filter out misinformation, but also encourages everyone to contribute thoughtfully to family discussions and decisions. With a proactive approach and a commitment to learning, you foster a supportive environment where accurate information thrives and resilience becomes second nature, preparing your family to navigate uncertainty and safeguard well-being together. Conclusion: navigating the disinformation era together. Disinformation is a challenge, but it's one we can meet together. By staying curious, checking sources, and leaning on trusted professionals, you can protect your family's health and help build a more informed, resilient community. Medical Dispatch will continue to bust myths, clarify headlines, and guide you through the ever-changing landscape of medical news. If you have questions or want us to tackle a specific myth, reach out. We're here for you. As we move forward together, remember that navigating health information is a journey best taken with support and reliable tools at your side. Embrace the habits of thoughtful inquiry and regular communication established in your home, and extend that same openness when engaging with your wider community. Whether you're seeking answers for yourself or helping a neighbor sort fact from fiction, your commitment to truth and understanding makes a difference. With every question you ask and every resource you share, you're helping to create a network of trust that lifts us all. Stay connected, stay curious, and know that you're never alone on this path to better health knowledge and community resilience. Community resources, who you can call. Let's wrap up today's dispatch with a spotlight on resources you can trust. If you're facing a health emergency or just need guidance, here are some numbers to keep handy. Poison Control, 1-800-222-1222, 24/7 help for household exposures. SAMHSA Helpline, 1-800-662-HELP Mental Health and Substance Use Support.ready.gov, emergency planning tips and printable checklists. American Red Cross, first aid guides and disaster prep. USAEBN.org offers very in-depth information on disaster preparedness and first aid guides. And remember, your local health department is a goldmine of info. They know what's happening in your area and can connect you to services. Thanks for listening to Medical Dispatch. Remember, this show provides general information, not medical advice. Talk with your medical team for care. If this helped, follow and share with someone you care about.